Yes, new additions to the pharmaceutical benefit scheme are IVF, certain contraceptives and endometriosis treatments. Dr. Matthew Leonardi is a gynaecologist and endometriosis specialist. Thank you so much for joining me on the Drive program.
Yeah, hi, thanks, Kylie. Thanks for having me.
And so from your perspective, what difference will this announcement from the Health Minister, Mark Butler, make?
Well, this is fantastic news. Medications for endometriosis are already few and far between, and lots of people have side effects or poor effects with the medications that are currently available. So this is going to open up options for people to have alternatives that have really been inaccessible to them previously.
Now, my understanding is that you have been actually using these endometriosis medications in Canada with patients. They haven't actually been available here. So what can you tell us about how these drugs work?
Yes. I trained in Sydney back in 2017 to 2020, and these medications were not available then. I then started my practice in Canada and have been using forms of these medications with a slightly different brand name there. And for some patients, they're very effective. The progesterone-only pill, the Slinda, is a great alternative to some of the currently available progesterone-only pills, and certainly some of the combined estrogen and progesterone-only pills. And then the Ryeku is something we've had available for about a year and a half now. And thus far, people have had really positive impacts. But with all medications, it's always got to be an individualized approach because it's not always going to work for the person that's sitting in front of you in the office.
And do you have any clarity from the federal government? I know it's early days. We only just heard the announcement in the past 24 hours. But do you know how it would actually work for anyone suffering from endometriosis financially? Will it be fully subsidised or partially subsidised?
I'm probably not the best person overall to answer that question. I'm not aware of how that subsidy will occur. But what I do know, and maybe this is a little bit of positive perspective for Australians, is that your pharmacare is far more universal, actually, than in Canada, where most patients don't have drug coverage. And so this, even if it's partial coverage, is great news.
Now, for anyone who's listening to the ABC right now and listening to my interview with you, Dr. Matthew Leonardi, if you don't have lived experience with endometriosis, how much can it change a woman's life?
Yeah, endometriosis is really a terrible disease. It causes effects in people's personal lives, in their professional lives. It limits people's career trajectory. This is a chronic pain condition that can really take over. So if there are options that are available to people that can help them gain control of their pain and allow them to achieve that full quality of life in their personal and professional spheres, it can be a game changer. And so we're really optimistic about having more options available for patients with endometriosis to aim for that improved quality of life.
And do you find that misdiagnosis is common? Because, you know, over the years we have heard this.
Oh my goodness, yes. Endometriosis is one of the most enigmatic diseases from a diagnostic standpoint, and for many, many years has been thought to only be diagnosable at the time of invasive surgery. But now we do have advancements in imaging, in ultrasound in particular, which was incidentally one of the main reasons why I had moved to Australia back a few years ago, to learn some of these really novel techniques. So it is difficult to diagnose, and it can be misdiagnosed for things like IBS or bladder pain. But we are getting closer to recognizing diagnostic tests like ultrasound and MRI in Australia for patients to get that earlier recognition and therefore earlier treatment.
And do you have any advice for the partners or husbands of people suffering from endometriosis, just about how they can manage their relationships? Because it must be quite tough.
Yes, for sure. I think the first thing that partners of patients with endometriosis, and also literally everybody in society, needs to learn is we must believe women and those who are affected by endometriosis. Believing them is step one. Validation of their symptoms is key, because these people are not making things up. They're not seeking attention. This is real, and it is invisible to everyone other than the person who is experiencing it. So I think just belief and validation is key. and being there as best as possible to support your partner or your work colleague or your sibling, whoever it may be, in whatever way that they need. Because it is a disease that is quite variable in how it affects people. We know people who have under and unemployment due to it, and we know people who are really professionals, full-time job, and it can affect everybody differently. So look to the person, ask them how you can support them, but belief and validation are the key messages.
And why, as a matter of interest, did you choose to not only become a gynecologist, but also an endometriosis specialist?
Yeah, it's a good question. So I sort of fell down the rabbit hole, as I say, or for those people who are fans of the Harry Potter series, the wand chose the wizard. You don't often make active decisions when you go through medical school and your post medical school training. It sort of happens to stumble upon you, things that you find interesting, intriguing. And for me, it was the interface, the connection in endometriosis care between the diagnostic dilemma, the challenges in picking it up on imaging and surgery, and then the surgical treatment. I'm a surgeon as well, and this is a very difficult disease to diagnose and surgically treat, and also medically treat. So that challenge for me was what was very attractive, and how much room there is for improvement in this area. Women and individuals with endometriosis have suffered forever, and most people have just ignored them. So we have so much opportunity to help this population with their quality of life, and that was really attractive to me for my career.
And Dr. Leonardo, it might be early days yet, but is there anything that you can share in relation to, the news about IVF and the funding that's from the 1st of April? It's going on to the Pharmaceutical Benefits Scheme, or also some of the contraceptives that might be funded?
I'm a little bit unfamiliar with the IVF coverage because I'm not a fertility specialist. I'm mostly an endometriosis surgeon and physician who treats these patients in the clinic. So I can't quite comment on the IVF aspect. But when it comes to the contraceptives, for what it's worth, Linda is a contraceptive. We do use a lot of contraceptives for treatment of endometriosis because endometriosis is a hormone regulated disease. And so if we can make modifications to people's natural hormone production from their ovaries and the effect of those ovarian hormones on the uterus, we can actually do a lot of benefit for controlling endometriosis symptoms.
Look, very interesting to chat, and really appreciate your time in what is no doubt a busy day for you. Thank you for coming on the program.
Yeah, of course. Thanks for having me, and good luck with the rest of your day.
Dr. Matthew Leonardi there is a gynecologist and endometriosis specialist.
Gonna close